Yo, what up? It's a tip of the week, and today we're going to discuss the limitations behind dental imaging.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
All right, number one is this. Remember, guys, when you're dealing with a PA, a pano, and now the sexy thing is CT images, remember, they're just machines. So the image that you get out is just as good as the information that you put in. And if there's error going in, there's going to be error coming out. And if there's error with the individual reading it, then you're going to have bad results. And so what I really want for you to do is take that in mind. Use it as an adjunct, not your sole reliable source for getting treatment planning, and or giving patients information. Your job as the doctor, and I remember my professor used to say this, you're the doctor, so you're the individual that people come to when they want to know something. And so it puts more onus onto you to get this information as it's coming out of the computer screen and understanding what information is pertinent for your situation and for your patient. And also being able to understand what is the information that just doesn't make sense, and also having the background or the wisdom to refer it out when it just doesn't make any sense. Number two is this: a good exam does wonders. I can't tell you how many times I'm working with a patient and they're pointing to one tooth and the x-rays say another thing. But as I do my clinical exam, you know, the thing that you use with a perio probe and a mirror, and you probe around different teeth, you do percussion tests, palpation tests, cold tests to determine what's going on. That is considered a good physical and clinical exam for your patient. And so I really want for you to take a step back, because there are limitations on your imaging. And I just want to give you a reminder that as you're doing your exam and as you're working with your patients, don't forget the human touch, the human aspect that could never be substituted with any machine. And number three is this: don't be solely guided. I know this sounds as if I'm repeating myself, but repetition is the mother of learning. And so even if you bought a $100,000 machine, a $50,000 machine, or even a $5,000 machine to give you good images, remember, don't be solely guided on it. You know, use it as an adjunct, allow it to give you information, allow it to approve one of your hypotheses or prove one of your hypotheses or your manners or way of treatment, but don't solely rely on it. You know, I was working with a few doctors this week, and they were asking me questions about, well, look at this CT. What about this vertical root fracture? What do you see here? Can we place an implant? Can we do this? And I'm like, guys, I only look at these CT scans just as information. You know, because I've done so many surgeries, I understand that imaging is great, but what you see in the surgical site means so much more. And so you want to get this information and have it as a storage so that when something arises, you'll be able to pull that information and use it accordingly for your patients. And so what I told them is the same thing I'm telling you. Use your imaging as a pal, a friend, or an assistant, and allow it to help assist you to the best treatment for your patient possible. So there you have it, guys. I'm Dr. Jared Williams, and my focus is for you to remember to smile after surgery. Make it a great one. What I want for you to do right now is click the link below on the like, subscribe, and I also want you to share this information to your colleagues. I also want to know your comments. How is this information helping you? Or is it even helping you at all? All right, guys, let me get out of your way. I know you got great things that you have to do, and most importantly, serve your patients. So make it a great one.